Thank you for joining us on today's broadcast. I'm Dr. Kimberly Hillyer, a nurse practitioner and the media correspondent for Neonatology Today. This segment features Dr. Benjamin Rattray. Dr. Rattray is the author of When All Becomes New, a compilation of his experiences and reflections over years of doing what we all do every day in the world of neonatology. Thank you for joining us on today's segment of Neonatology Today Media, and I'm here today with Dr. Benjamin Rattray. Thank you for joining us today, Ben. How are you doing?
I'm great. Thanks so much for having me.
Thank you so much. You wrote a book that is very inspiring for me because it's an area that I'm working in. It's a story of not just you, but individual families and babies that you've come in contact throughout your career. Can you tell me a little bit about your journey into becoming a neonatologist?
Yeah, so the story really starts for me in college when I started as a psychology major. I was actually a psychology and English major, and I took an abnormal psychology class and really got interested in the medicine and the sort of the physiology behind everything. Funny enough, it's funny how these things come full circle because my mom was actually a district nurse in New Zealand, and before that, a midwife in England. And so I had had some exposure to medicine through her. As a kid, sometimes that exposure kind of scares you a little bit, but it also, I think, fascinated me and intrigued me. So kind of looking back now, I think that was probably a big part of it. Every once in a while when I had a day off school and she was working, I was able to go around with her. She drove to each patient's house to see them and check up on them. I don't think it happened very often, but it definitely made a big impact on me. So anyway, that kind of started my interest in medicine. I always loved kids, was excited to look into pediatrics and was also really interested in neurosurgery for a while and thought that was going to be my residency path, but ended up choosing pediatrics, and then going through the different rotations, really fell in love with pediatric intensive care, neonatology, and then ended up in neonatology.
Now, your book is, like I said, your life story in a sense, because it goes from your introduction into medicine in the world of neonatology, being a fellow, and then going on to becoming an attendee. Can you tell me why you felt that it was very important to see growth and progression of you as a physician through these stories?
Yeah, so that's right. So yeah, there are kind of those two elements of the book. One is each chapter is a different patient story, but it also really follows my arc of training. Sort of that young idealistic, way that we kind of come at things, and then sort of reckoning with some of the difficulties, as some babies don't make it, and we do have some really difficult outcomes. Also a faith struggle as I'm kind of going through all of this. So it seemed like the logical thing to do as I was laying out the chapters was to do it chronologically, as I'm kind of moving through my training and as I'm, maturing in my journey.
And what did you feel was the biggest difference as you were putting these stories together, as you moved from, let's say, the fellowship to becoming an attendee?
Yeah, one of the biggest things, and I'm not sure, to be honest, that this part of it comes through as much in the book, but one of the things I think for most people when you're in training, certainly myself, you're really so focused on the medicine. You're just trying to get your medical care to be right. You're trying to get the right diagnosis, the right medications. You're learning your skills, putting in, umbilical lines, doing intubations. That's really, I think, where the focus is. And I think it should be. I mean, that's such an important part of the step. But I think as time has gone on, I'm probably more focused on the families and, the relationship that I have with the families. I hope that comes through in the book, but I don't know, that I necessarily spelled that out exactly.
I think through some of the stories, you could definitely tell as you were standing there. I remember one of the stories, behind is you were still kind of an outside observer, watching this family as they mourned the loss of the child. I think you really were able to show that in those moments. So you have some ups and you have some downs, as you said. That's the roller coaster of the NICU. Can you tell me a little bit about one of the ups that you've found helps really get you through some of the really lows of the NICU?
Yeah, so one of the ups, there's a story about a baby girl called Faith, and she was born, really early, about 24 weeks. And like a lot of 24-weekers had a really rough NICU course. But her parents were amazing. They were like the light of the unit. They would come in and hug everybody, really upbeat, really encouraging. It was like, you felt like, well, we should be trying to encourage you, not the other way around. But they were just amazing parents. But they certainly had some really difficult times. And I was there in the delivery room when she gave birth. And then I actually got to be there on the day that she went home. And she did great. She's just like this beautiful girl now. In the book, I talk about actually, I was at my daughter's preschool, sort of graduation, and this and Faith was there too. She just happened to go to the same school. So it's just like one of those really great stories that you go through a lot together, but the outcome is really great.
And I know for me, that was definitely one of the stories that I enjoyed, because you're right, you need to have some of those very positive, heartfelt moments that remind you once again of the positive aspects of why you do some of these things. Now, we also experience some very low lows. Can you tell me about one of yours and how you were able to adjust and move forward?
Yeah, so one of the other stories is about, it's called The Sniper's Son. And the reason for that is because the father was a sniper in the Army. And I met him several weeks into his son's NICU stay. I had met the mother and kind of formed a relationship with her, talking with her each day. And then one day the dad came in and we kind of struck up a conversation. And I guess he was in some sort of Army fatigues, and he kind of ended up telling me what he did. And I just remember thinking at the time how we were in such different worlds. But his son was doing pretty well until all of a sudden he got sick with necrotizing enterocolitis. And it just happened so fast. It really started overnight. I came in the next morning and saw the x-ray and just couldn't believe it. It was awful. So I did anesthesia for the case, and the surgeon opened him up. And essentially it was just black necrotic bowel, all the way through. So we had to make that really, difficult decision with the parents to withdraw support. But when we did that, the father showed up, where he was with the mother, and a lot of the men from his unit showed up in their full military dress uniform, and stood with the mom and the dad and supported them. And it was really difficult because I was still in training, and it was just that feeling of total helplessness. There was just nothing that we could do. I mean, we could keep his son alive for a little bit longer, if we had, needed to, but we couldn't ultimately save him. He had no bowel and was too small for an intestinal transplant, and there just wasn't anything that we could do. It was really difficult. And I remember too, we talked about the case in M&M conference that next week. And it really struck me how we talked about the medical part of it. How quickly did we start an antifungal? Which antibiotics did we use? We really, we looked at those initial films and we just kind of dug through the whole case, which was appropriate, is the right thing to do. But I just remember thinking about how we didn't talk at all about any of the other parts, kind of that interpersonal part of the case. Nobody in M&M really knew that, this guy's regiment had come in and stood there with him. And And just remember just walking outside, you know, at the end of the day into the North Carolina sunshine. It was still summer, and just walking back to the car, just trying to kind of take it all in. So yeah, I definitely remember that one.
Now, I know that that is definitely one of the hardest parts of our job for sure. And as you're trying to come up with words to comfort the family during these uh, most difficult times in their lives, have you found anything that you feel based on your your faith or your belief that you feel really helps you to find that connection with the families?
Yeah, so I think one of the things is, you know, kind of getting back to that early training, I think that what I thought at the start was that I needed to sort of, you know, have that distance, that emotional distance from the parents. And that I needed to be so professional that the only thing that I was communicating was, you know, the medical information. Um, and so what I think I've found is there's more power in just sitting there and being quiet and just not even saying anything. Um, I think there's more power in that than than trying to say a lot of words. And I think that, to be honest, there really isn't anything that we can say that really makes it better. You know, perhaps other than just saying, "I'm so sorry that this is happening to you." You know, sometimes I'll give the mom a hug. You know, depending on kind of, you know, if that seems like it's appropriate or not. Um, but I think the biggest thing is to just show how much we care. You know, and I think if a tear slips out, it's okay. You know, I think that as long as the family knows that we truly, truly care. Um, and certainly I think anything else, you know, comes across as trite. You know, it's interesting because, you know, for me, I do take comfort in believing that, you know, God makes all new, um, you know, for these babies, but at the same time, it's not something that I would say out loud to the parents because um, I don't think that there's comfort in that. You know, certainly not at the time. Maybe at some point in the future, but it's not something that I feel like can really be expressed. You know, certainly not at that moment.
Absolutely. And as we are seeing more and more premature babies, extremely immature, extremely low birth weight babies, I feel like we are having this opportunity more so. And maybe it's just me, um, to where you're having these extremely long courses. And sometimes you think you're out of the woods, and then you have something like you said, the NEC happens, and then you're having to just readjust and reconnect with the family, and sometimes you have to go through these moments with them, um, but you're not doing it alone as just the physician provider. You have this whole team that you're working with, and you were just speaking about the M&M conference and how you talked about the technical aspect. How can we, as a full team in the NICU, deal better with these kinds of situations? Do we just let palliative care be a part of it? Do we incorporate that into our field? How do you suggest that we work as a team together?
Yeah, I mean, I think part of it is exactly what you said, is we work as a team together. You know, this is really something that always it's a team activity. You know, you just can't stress that enough, in terms of the bedside nurse, the nurse practitioner, respiratory therapists, you know, all the people that are involved in the care of the baby. And I do think that, you know, we definitely should incorporate palliative care. That's something that we do at our hospital. Um, because, you know, for some babies, like you were referring to, that are born so early, it is a trial of life. And we often do get to a place where palliative care is the right thing, um, you know, for a baby. And then having the resources and the best setup to guide parents through that, I think is really the best thing to do.
Now, as you were telling these stories, it's not just your story, but it's someone else's story, a family story. were there any concerns that you had when bringing these stories to life for the reader?
Yeah, so there are huge concerns when doing this. Part of it is I feel like I'm just tasked with the hugest responsibility to get it right. Because these, I'm remembering babies' lives and I'm remembering families. So that's perhaps the biggest weight that I felt. And I really felt compelled to tell their stories too. So it was sort of, both feeling compelled to tell the stories and really wanting it to truly portray what happened the right way. The other part of it, of course, though, too, is privacy and protecting families' privacy. So I changed a lot of details to make sure that I was providing, that level of privacy for families. There's one family that actually asked. I ended up interviewing the mom to get a little bit more of a story from her perspective, and she wanted me to keep her baby's names the same and keep the story the same. So there's one chapter where I actually didn't change anything, and that was based on her request. And then there's a reunion chapter where I used the baby's name again because the mother asked me to. But everything else, I've changed things. The essential part of the story is exactly the same, but enough has changed so that you can't tell which baby it was.
And as we go through this book, we're seeing your growth, as you said. But what kind of growth or direction do you think this book can help for others?
Well, my hope is that it helps us with connection. I've had a lot of nurses read the book who say, gosh, I didn't know that you felt this way. We feel this way too. And I think that kind of speaks to the way that we practice. We can have a pretty rough day, and at the end of the day, everybody goes home, and we talk during the day about the medical care, and here are the orders that are changing. Here's the plan of care, asking the bedside nurse, what they think about certain things, but we're really not talking about the emotional part of these situations at all. So I think partly a book can really help bridge that gap. I think we should be talking to each other as well, but I think sometimes you can express things in a book that you can't always say. And sometimes, especially for me, it takes me a long time to figure out what I'm feeling and thinking. And a book allows me to do that.
And so with this book coming out, you said nurses come to you and reflect on some of the stories that you told and then seeing themselves in it. Has it changed your practice and your interaction today?
I think it's changed it in that I feel even more comfortable with parents in terms of, just trying to interact with them where they are, and just trying to be more personable, certainly do all the right medical things, but also be just more human, more down to earth. That's the goal, just more connection, both, with the parents, and also with all of us in the NICU as well, all the staff.
And as I remember reading through some of the different stories, some of the different chapters, things like, that sniper story, that was extremely powerful to me. Was there a story that didn't quite make the cut of the book that you really felt was also powerful and may have changed the direction in which you viewed things?
Yeah, so that's the interesting thing, is there are actually chapters that didn't make it into the book. And the hard part, I think, about a book like this is that you do end up with some cases that just aren't as dramatic. You have a baby who's maybe delivered early, has a really sort of significant course from a parental standpoint, but it's just not something that you can really write down in a way that's compelling, or really, sometimes the stories just don't really go anywhere. And so I definitely had some chapters like that I really, really wanted to make work, because, I had a strong interaction with the parents. I really, cared about the babies, and I really wanted to tell their stories. but every time I rewrote the chapter, it just didn't go anywhere. So I don't know that it really changed the book necessarily, but and then there's another story that I wish I could have put in, which was actually the backstory for the baby that was that I saw at the reunion. So he actually had high drops, but it happened so far in the past, and probably when I was so sleep deprived as a fellow, and I just could not make it come alive on the page. So I ended up putting him into the reunions chapter. And the thing that's really interesting about that, though, is I realized that's actually where he belongs in my story, because as significant as his story was in the NICU, he's more significant in a way to me now out of the NICU, because his mom has texted me pictures, and sent me photos as he's grown up, and getting to see him like grow up has just been amazing. And so he's really significant to me, more in that reunion way than he, not to say that he wasn't significant in the NICU, because he was, and I remember that time really vividly. I just couldn't make it come alive the way I could once he was out of the NICU.
That's understandable. And I really think that, like you said, that reunion part is very powerful. And, also is one of those factors that keep us moving forward and driving forward. Were there any times during your fellowship or as an attending where you felt that one of these stories, whether one that's made it in the book or one that wasn't able to make it in the book, really have you reevaluate the direction in which you were going as a physician?
Yeah, that's a great question. I think I've always been pretty steadfast in my direction. I don't think that I've ever really hit that place where I thought, I'm going to throw in the towel and not do this anymore. I certainly have had times where I've really had, maybe self-doubt and really worried. One of the stories, we have twins, and one of the babies ends up having sepsis and dies. And the other one, because of the other twin getting sick, alerted us to look for, we did a CBC early screening for infection, and it really flagged as high risk. And we got a blood culture, started antibiotics. And sure enough, the other baby was also bacteremic and getting septic. And that was a really difficult time, in a time where, I really wondered, had we started the right antibiotics on the sibling who died, and was there more that we could have done? As it turns out, we did start the right antibiotics, and we did everything we could. But it definitely, was a stressful time, and really made me wonder if we'd made the right choices.
Now that stress, the continued questioning of, whether or not you ordered the right antibiotics, ordered the right labs, it doesn't just stop as soon as you walk out of the neonatal intensive care unit. How do you deal with that going home?
Yeah, so you're right about that. Yeah, you just bring it right home. I try and have that decompression time as I'm driving in the car. But the truth is, you bring it home. And, I think I even wrote in that story, I was periodically going to my laptop and logging into the electronic health record to see how the baby was doing, see what the blood culture was, see what the sensitivities were. So yeah, I think the main thing is to try and stay grounded as much as possible. I really try and be in the moment with the kids, be in the moment when I'm at home, really focus on those things. And sometimes I do a better job than others. Sometimes, even the administrative part of work can get the better of me. Sometimes I'm checking my cell phone, checking my work emails, at 9 o'clock at night. And I think, why am I doing this right now? Whatever is on my email can wait until tomorrow. And I think that, there's that weird mix of administrative and leadership responsibilities and the clinical responsibilities that sometimes it's really hard to walk away from.
Absolutely. And I can understand that. Has this been something that you've just started to realize, or especially with the pandemic, where we've really had to put a mirror in front of us as far as being in the healthcare field, to learn how to, as you say, decompress and to step away, to find that healing for yourself. Was this something that you've been working on throughout your progression, or is this something that, during this pandemic really has made you kind of focus on?
Yeah, I mean, I think both. I think I go through these cycles where, I'm not very good at my work-life balance, and things feel really out of kilter. And then I'll kind of set some guardrails, I'll say, that's it. No more logging in, at night, no more checking my email, past like 6 or 7 at night. I'll sort of put those guardrails in. But then something will come up and I'll end up, kind of falling back into it a little bit. So I think it's, keep recalibrating. But I think with the pandemic, it definitely puts the pressure on us to draw those boundaries in a way, because, it's been such an intense time, even for us in neonatology. I mean, I can't imagine, for our colleagues in adult intensive care. But I think certainly, we really have to remember kind of, who we are as people, and do things that help us to decompress.
Absolutely. And as we've now gone through this pandemic, we're also going through a time where politics is once again becoming a factor, and especially in the neonatal world, it may become a factor as our legal system looks at Roe versus Wade. Do you have any kind of thought process as far as how you think this may affect us in the neonatal world?
Yeah, that's a great question. One of the interesting things this morning, I was just listening to a podcast that was really focusing on the nuance of everything. Right now, as you're alluding to, everything is so incredibly polarized. And the reality is there's so much more nuance to everything than, I think the politicians at least can really allow for. So I think more than anything, if we can care for and love the people around us, my opinion is that that's what we're called to do. And yeah, it's interesting to wonder, how these changes might affect us. Yeah, certainly something that, I've been thinking about. And it's tough to say right now. It's so difficult to predict how things will be in the future. But I think, especially in healthcare, I think we're called to serve the people around us. And so I think that's where our focus should be.
And I know that in our neonatal world, there is this balance with ethics, and especially when it comes to these extremely low birth weight, pushing the boundary of 24, 23 to 22 weeks. Is there a point in time where you think us in healthcare and in medicine, we just won't be able to push anymore, that will cause a direct conflict with what's going on with the rest of our society?
Yeah, it's a great question because it feels like it always changes. If you talk to people that are older than us, for example, they'll say, wow, I remember when, 28 weeks was just the earliest that we could, save a baby. And here we are, we're wrestling right now in our center with 22 weeks, trying to decide how ethical is it, for us, given our outcomes, to really push that boundary. And I think, like a lot of centers around us, we're really struggling with that. It certainly feels right now like 20, I just can't imagine going lower than 22 weeks without a massive change in technology, in the way that we practice. That would be a completely different paradigm. I would have thought, so but it's interesting because you wonder if if anyone ever looks back on this interview in 10 years or 20 years, things could potentially be so different at that point.
You're right. And technology changes consistently, and medicine, we keep pushing the boundaries. And so it's been amazing to see. I mean, neonatology is still considered a very young part of medicine.
Yeah, but kind of like you're pointing out though, at what point are we doing families a disservice? Because if you get to that point where the outcomes are so poor, then we're really doing a disservice. On the other hand, though, I mean, this is the tension. There's always so much tension here because we want to help families, we want to save babies, and some babies have really wonderful outcomes. Like we were talking about baby Faith, who's born so early and had such an amazing outcome. But then you don't want to pull, these kind of, sometimes you can pull an outlier case and then base your whole practice on that. That doesn't seem like the right thing to do either. So there's a very real tension. And as happened to me last week, it happens at 2:00 in the morning, very, very quickly, with a baby who was, approaching 23 weeks. And it happens, I had 5 minutes to talk to mom. Dad was out of state, and 5 minutes, 2:00 in the morning to make these really big decisions. So yeah, these things are never easy.
Now, these decisions aren't just, NICU to parent, but we also bring in our OB colleagues. And they're also struggling during this time with maternal death rates. Is there a way that we are able to collaborate with them on dealing with the holistic care of a family when there may be issues with maternal mortality and morbidity, and then the neonatal side of mortality and morbidities?
Right. Yeah. I mean, I think that's the most important thing, is having that collaboration. Sometimes everything happens so quickly that it's hard to have a good conversation. But it's the ideal case is when we can. I had a case where I was working closely with maternal fetal medicine and the OB over a course of 2 weeks. We had a baby that was actually too growth restricted for us to be able to intubate if they delivered. And so that was a case where, even though the chance of intrauterine demise was fairly high, since it was essentially 100% if they delivered, we just kind of tracked everything really closely. But that was a good situation where we had really good collaboration, and we had a great outcome. So I think that's the key, because, like you're pointing out, we're not just balancing, it's not just the baby, we're balancing the mom as well and the mom's health. So we really have to keep everything in mind, and hopefully have really good, discussions.
And as we talked earlier also about the technological advances that we've seen, we're also seeing advances when it comes to the human genome. How do you see that playing effect in our medical management and care?
Yeah, that's a great question, and one that I don't think I can answer right now. Certainly, it looks like, well, we know that there is the technology for isolated diseases to modify those. And once again, it seems like there's so many ethical questions that come up, both for us and for the obstetricians, because you can certainly see situations where, modifying something to get rid of a lethal disease could be very beneficial, or a disease that's a lifelong impairing disease. You can certainly see the benefit there. But then it's also easy to quickly see how that can become a very dangerous situation where, you're no longer just modifying single diseases, but you're kind of, modifying all sorts of things and really tailoring, which could be a very big problem.
I can see that. And one of the things that you had talked about was what you hope, for example, or can see your colleagues getting out of this book. But what if a parent was to read your book? What would you hope that they would get out of it?
Yeah, it's interesting because I've told a number of parents, do not read the book, because I'm afraid that it might cause some sort of PTSD, for them. Or at least if you read it, please wait until you're out of the NICU. I mean, that's, definitely important. Um, but I've actually had a number of parents have read it and have given feedback. And a lot of them actually just said it really helped them to know how much the medical community cares about their babies, because they can see, we're thinking about their babies as we're driving home. We're thinking about their babies at home. We really, really care. We're not just, punching the clock 8 to 5. This is our life and we really care, and so I think it really helps them to know that. Um, and so, yeah, I've actually had, really good feedback from parents. But in terms of the target audience, I wouldn't say that that's really my target audience. But, it's been surprising. I thought that, talking about target audiences, I thought that maybe the nurses wouldn't be that interested in the book because it's kind of like reading about what you do at work all day. It's like, maybe you just want to come home and, watch like a legal thing or something, like totally removed from work. But they have been my biggest supporters. And so, there's sort of surprises, I think, along the way about who finds, who wants to read the book, I should say.
Well, it definitely hit home for me, and I enjoyed reading it as a nurse. And I could definitely see your thoughts as far as what it's like for the parents to read it and why you might not want to have them read it, but also for those parents that did read it, letting them get that sense that we do care even after, and like you said, we're not just punching the clock. If you were to write another book, what do you think that book would be a reflection of?
Yeah, so I think I'm done with the NICU stories for now. It's hard to imagine writing another book because I feel like it would just be too similar. Um, so yeah, I think my writing at the moment is more just kind of articles talking about reflection, talking about drawing near and observing. Um, I'd like to try my hand at a novel. I've got a rough draft and I'm not sure if it's going to go anywhere. So yeah, it's all up in the air right now.
Well, you were able to put together some really compelling stories, some heart wrenching stories. So, whatever direction you choose to do your next book in, I'm sure is going to be just fascinating. And is there any other work that you're doing out there that you would like us and my audience to know about?
I think the biggest thing right now is I'm mainly involved in local leadership in our NICU. I do have a website, which is my name, benjaminrattray.com, where I'm putting some blog posts and also some links to media. Yeah, definitely. Each blog takes me a very, very long time to put up onto the website. It's just, I'm a very kind of slow writer. And so, some people I know can put out a blog a week or a blog a day. And it turns out that's not me. But I do have, some blog posts up there. So that's where I can be found online.
Well, I look forward to going to that website and checking out some of those blogs. I'm
Thanks.
just like you where, yeah, I don't write a lot. I think I talked to someone and they said within their first day, they just wrote pages and pages, and I was just amazed.
Oh, I know. That is not me. I mean, Hemingway said writing is easy. You just sit there and bleed. And that is me. It's like I could spend an entire morning changing 2 words around and then put them back the way they were, or like one sentence could take me an hour. Um, so it's a pretty slow, sometimes painful process. Um, but it's also very rewarding when I feel like I've been able to express some of the things that I've been, thinking and feeling.
Well, I think this book really did grasp some of those things that you were feeling as you processed and went through, your journey into neonatology. And I hope that you continue to find that balance, that work-life balance, and find the pleasure in writing, your next book. And then I look forward to seeing the blogs and anything else that
Thank
you're
you. I
doing.
appreciate that.
So I want to thank you for joining us on today's segment of Neonatology Today with Dr. Benjamin Rattray. Thank you for joining us.
Thanks so much for having me.